there in the market. So I'm just flashing a few that perhaps you have used, but there are quite a number out there in the market. So when you are having your dogs, how do you interact with your dogs? So when you walk or introducing your pets, how do you do it? So do not allow your dog, if they have not been used to another pet, how to allow them to express their normal behaviors, like what you're seeing, the dog who is peeing on a fence right there. Then there's this dog who thinks they have no idea why you're yelling at them, but that feels really scary. So do not shout at pets or beat them, because they cannot speak your language. They have their language, and this is being gentle to them, and they will appreciate that. Why do you keep a dog? Security and safety. You have guard dogs, police detection dogs. Dogs have been scientifically proven to give better social skills. So if your kids grow up with dogs at home, they are always respectful towards living things, and they have better social skills and social life, and they become empathic and become they can be empathetic towards people. And this I've put here because the generation that we have today, parenting has shifted, everything has shifted, and we need to look at parenting differently. So if children are not interacting with other children, children are not interacting with relatives, then this is the point you want to introduce a pet, so that they are responsible about something, they are responsible about, they take care of their emotional sanity and all that. So that is a reason to keep a pet. Then there is better responsibility in life skills. If you're responsible for another life that is not your own, especially for kids, then you are able to keep and up your life skills. And now we have the era of serious mental health issues. So pets are able to come in and bridge this gap at this point. So this is a point, the reason I put up this, for us to be able to do that. So when you have a pet, then you have proper mood enhancement, unconditional love from your pet. And people who keep pets, especially for the elderly, they are said to be able to maintain good health in terms of low blood pressure and keeping fit, especially those who walk their dogs regularly, because as they walk their dogs, the dogs keep good health, they keep good health. So this is good. Pets have also been shown to reduce stress and loneliness, so they provide good company. And then there are specialized pets, the ones that give therapy support, and therapy dogs that are out there. So these are some of the things we keep dogs for, and one can benefit from from each area. We are in the era of social media. There are other functions that are out there in the social media, but perhaps they are not what is right for the pets, if you know what I'm talking about. Let me talk a little bit about pet nutrition. So pets develop behavior from the routines that you give them. If you feed your pets on sausages, they will develop a behavior and a routine from that, and they will not be able to eat other foods. So what you want to target as you get a pet or as you bring up your pet is that whatever you're giving them is a balanced diet. Sometimes pets will eat food that is homemade or can be commercial dog food. If you choose any, stick to one, but just whatever you're giving your pet does not have the ability to harm the pet in terms of levels of aflatoxins. We have seen families that eat the same ugali with their pets, and the pets come down, their dogs come down with aflatoxicosis, while the humans don't, because the level of tolerance is different. Pets, especially dogs, are able to, their tolerance levels of aflatoxins is quite low compared to humans. Able to pick that if they come down with aflatoxins, then it's a good indicator that what you've been eating is not proper at all. And the choice of your food depends on your finances and the availability at any given time. Treat the dog with things that are safe, so no chocolates, chewing gum, and etc., because these are dangerous to dogs. Whenever you want to introduce anything new to your pet, read about it, consult your vet about it, just to ensure that your pet is taking what is healthy and in the right quantities. So avoid giving dogs high carbohydrate diets. This is an example of ugali that I just talked about. But the truth be told, Kenyans are feeding their dogs on a lot of ugali, which is not right. So dogs are very sensitive to mold, and it will die of aflatoxin poisoning. The aflatoxin levels that will kill a dog are not the same that will kill you. You will be fine and healthy, but the dogs are very, very sensitive to aflatoxin. So if the ugali that you're feeding your dog brings them down with aflatoxin and you're eating that, the fact is that it has high levels of aflatoxin that you better keep the food well, and that's good. So keep dog food away from wet or moist areas, because this is how they catch the mold, and then at the end of the day, they have that aflatoxins, and then they keep their plates and water clean. They can get sick from this if the hygiene is not proper. We have bacterial infections, among other things. The time of feeding, so these guys are Sakaja in his calculations at his degree level. So these guys are calculating, and finally they get that it's dinner time. So they will know when you have given a routine that dinner time is this hour. So keep routines regular. So keeping time for pet feeding and keep it constant daily. This ensures that they have a proper routine and do not have a code of behavior that you want as a dog owner or a pet owner. Keep quantity of feed constant daily. And if feeding more than once, then you keep time for both meals. So if you're feeding 3 times a day, keep time for both meals, because this determines the time your dog goes to the toilet. So if you don't want them to soil the house, then they should be fed at the right time, and then they are walked out to go to the toilet out. So these are part of the basic things that you can do at the house level. So if you want to feed once again, you are having a puppy, you're feeding 3 times a day, but now you want hoping to one day feed the dog once a day, because of your schedule does not allow you to feed maybe in the morning, or you have some time in the morning and no time in the evening, then you want to reduce the quantities. So you intend to feed the dog about 500 grams of commercial or dry food. So you want to divide this. So if you intend to feed in the evening, then you cut your portions, reducing the morning portion, reducing the lunch portion, and increasing the evening portion until you get to what you require as the single meal. So this is what we are talking about. Eating once, then you gradually reduce the portions. And that just, if you're introducing new food to your dog again, also just ensure that you do this gradually. Do not introduce a new food to your pet and give them a full meal at once. No, do this by reducing the other quantity that you've been feeding routinely, and introducing this in little bits. And when you notice any changes, talk to your vet to understand if this could be a transient change, or it could be something that would affect your dog in the long run. There is grooming sometimes that is done, and this mostly is required by pets that have long coats, and this needs to be done regularly, because if they are indoor pets, then if this is not done regularly, then the fur gets brittle at the edges, and they really shed on the seats and on the beds and everything. So this is the reason why grooming is important, and most of the time grooming goes hand in hand with flea control and tick control. So if your pet has a lot of fur and this gets matted, if not well taken care of, then once in a while you need to do this, because grooming ensures that the dogs get the hygienic care and the cleaning. So this makes them look presentable to everyone, including yourself. So grooming is done weekly, and this is when you're going to ensure that your dog has a long coat, and you have your brush, and you ensure that you brush them appropriately. This also includes a wash, the medicated wash, the shampoo that you use for washing. Just ensure that it's pet friendly. There are products that you don't use on cats. I will be coming to that. And there are products that you use on dogs and don't use on the others. So if you are going to do this, then just ensure that you use pet-friendly products. Cats are very, very sensitive to certain products, and you want to ensure that you use the right products for the pets. So grooming, when I say is done weekly, this is when you wash your dog every Saturday or Sunday. Just ensure there is a lot of sunshine This weather is not very conducive for many things, because of to ensure that your pet is cleaned, is washed in warm weather, when you can actually ensure that they dry without freezing. So, or if you have the luxury, you can actually blow dry your pets after a wash, but just ensure that you're not putting too much stress on them with the wash. So as you do your grooming, I've said it goes hand in hand with flea control. So if flea and tick control, so ticks and cats and dogs need regular flea medication, flea and tick medication, and this goes on to prevent fleas, ticks, and mange or mites. So when you do this weekly, what are you trying to achieve? You're trying to beat the life cycle of the bugs you're trying to deal with. So what is their life cycle like? So their life cycle is a period when you are able to get the bugs hatching. Once they hatch, then they become larvae for ticks. Once they become larvae, then they become adults and move on like that. So as you do your wash every day, especially those who live where there are gardens, what you're targeting is the different life cycles of the ticks or the fleas that are out there. So as you wash your dog this week, you're getting to deal with the current adult population that are already on your dog or your cat. When you wash the next week, the ones that were in the other stage will have developed and now attached, and that's why you're doing it regularly. So when you wash your dog, there are those who use shampoos for the washing of their dog. So I will give an example of doo-doo cream. And the people who use doo-doo cream, first of all, you realize that they use it for the soapy feeling of the doo-doo cream, but they don't realize that the active ingredient in doo-doo cream should not be washed once you finish washing your dog. So you find that they will wash the cat or the dog with doo-doo cream. It's not supposed to be used on cats. So they'll wash the dog with doo-doo cream. And then once they wash the dog, after the wash, the soapy feel is done, then they will completely rinse the dog with clean water. It means you have washed all the active ingredient off. The product is very less likely to work. This applies for all medicated shampoos that are supposed to help you with tick and flea control. So when you rinse the dog completely with clean water, or the cat, it means the active ingredient is washed and the dog will be clean, but not without protection against the bugs. So what you want to ensure that you do is that you leave the residual effect. So you just ensure that once you clean the dog, that's why you're cleaning the dog or cat in good weather, they are able to maintain the residual effect of that product throughout the period until the next wash. So when you're using that, also ensure that you don't rinse off the product. If you're using spot-ons, the same applies. Do not wash your dog soon after application of the spot-on. You can wash the dog, then once they dry up, then you apply the spot-on. These ones do not apply to the tablets on the other side. So when you're applying spot-ons, most of the spot-ons will last your cat or dog 1 week, 1 month of activity. So once the 1 month elapses, then you're supposed to redo the wash. So if you were to use spot-ons today, wash the dog first, let the dog or cat dry completely, then apply the spot-on. So between the period that until you're washing again in 7 days, you will have ensured that the medication is absorbed into the system. So the spot-ons work by getting to the skin, and because of the blood supply on the skin, this is absorbed into the body and they are able to take care of the ticks and fleas. So people will ask most of the time that my environment has a lot of fleas or ticks. Just ensure that your pet is well taken care of. If the environment does not have very high load of fleas or ticks to warrant fumigation for that purpose, then just ensure that your dog or cat is properly medicated. And it means that over time, you will clear what is in your environment, because every time this gets onto the pets, then this will be eliminated. And if that continues over a period of time, your environment should be clear. But if there is need, then you need to consult and get the service to fumigate your area. So if we look at the products, we have different products. I've said we have the shampoos that you use for washing your pets regularly. We have the spot-ons that you also use regularly. So the shampoos, most of them are recommended for weekly use. Depending on the brand, some can last longer. The spot-ons are recommended for monthly use, about every 30 days. Again, depending on which product you're using, the manufacturer's instructions supersede everything that I would say on a specific product. Again, then there are tablets that are used for, again, flea and tick control and mange. When you use this, again, there is NexGard that one tablet will last a month and you get a pack of 3 tablets, so that's 3 months. Or when you're using Bravecto for both cats and dogs, then you can have 1 tablet serving the entire 3 months. So the longer the period, the more costly the product is. And some of them are fairly new in the market, so the resistance is not there. So they tend to be quite efficient and effective in terms of flea control and tick control. Let's talk about vaccinating your cats and dogs. So if you get a kitten, your queen cat has given you kittens and you want to get them in good shape and good health, then it means that you have to start their vaccinations at 6 weeks. So by 6 weeks, you ensure you get cat flu vaccinations. Cat flu vaccinations is the infection that you see the eyes begin getting an infection and producing a lot of fluid, and sometimes it gets pus. Then there is difficulty in breathing. You get the nose producing a lot of mucus. Sometimes it can get to the level that it produces pus. If these cats and cats are not attended to in good time, especially the kittens, most of them will die, because when there is respiratory difficulties, then they will die. Sometimes you get that the eye will get infected so much that the eyelids glue together. When they glue together, then this infection can continuously infect the eye to the point of blindness, or when treated, then these cats can get better. So when they get to 9 weeks, again, you repeat the same injection. Cat flu is a combination of many other things that happen to the cat. So it's not one pathogen affecting the cat in this case. When you get to 12 weeks, this is the time to do your cat flu and anti-rabies. And then 15 weeks, you repeat your anti-rabies. And this is what is referred to as primary vaccination of the kitten. So once you do all this listed here, you have concluded primary vaccination of the kitten, and you now move to annual vaccinations of this kitten. So anti-rabies is very important, and that's why you want to ensure that your cat gets this, because rabies is fatal when it gets to any animal. Here, management is not provided. And the management out there, even for post-exposure prophylaxis, is not cheap. So you want to just ensure that your cat is vaccinated appropriately, and you are able to be sure that my cat is had preventive medication and they are okay. So cats are very funny, because if you don't vaccinate your cats against rabies, you may say that your cats are indoor. But if they go outdoors, they can go over the fence and also be able to contract rabies out of your compound if you have a perimeter wall. Also, other cats that come from outside can actually get into your compound, no matter what type of a fence, and also be able to bring rabies into your premise, so, or other infections into your premise. So these are the reasons you want to ensure that you get your cats vaccinated appropriately and in a timely manner. So for the adult cats, you want to ensure that they are given cat flu and anti-rabies yearly, and this ensures that they are protected. There are areas in the world where rabies is given every 3 years, and this depends on the level of the risk. In the part of the world we are in, the tropics of Africa, and in Africa as a whole, rabies is highly prevalent and endemic. This means that it's very common to find rabies. So if we are to open our vaccinations to say every 3 years, then we will leave our cats vulnerable. So this is the reason you find that when you go to the West, to Europe and the other places, you find that they do their rabies vaccinations every 3 years. But here in this part of the world, we do it yearly because our risk levels are very high. We are in a hotbed of diseases. Feline rhino, so cat flu has two active ingredients in it, or rather protects against feline rhinotracheitis, which is what causes cat flu, as well as the calicivirus that is also in the vaccine, and also protects about feline panleukopenia. So feline panleukopenia, for those who are conversant with dogs, is referred to as cat parvovirus, because when it affects the cat, then there is diarrhea. There's a bloody diarrhea and a complex of all kinds of symptoms that you see. And most of the time, if your cat did not have prior vaccination or has not been taken care of by your vet when they get unwell, so your cat can actually easily succumb to feline panleukopenia. It's not a very interesting scene to have your cat have feline panleukopenia, because it is a real nightmare. How do you vaccinate your dogs and puppies? So when you get to 6 weeks with puppies, start them on parvovirus. So parvovirus is the infection that affects puppies, and you find that they have a lot of bloody diarrhea. This bloody diarrhea, sometimes people refer to it as teething, as the effects of teething. No, it is not teething. Parvovirus, and people say that when they swallow their teeth, that's the myth around it, when they swallow their teeth, then they will die. No, it's not teething. Most of the time it's parvovirus, and this is very contagious in kennels that do breed, or in kennels where there are adult dogs and puppies, because the adult dogs most likely will be vaccinated. So at the time you're hitting 9 weeks, you get to something called DHLP. So the abbreviation is DHLP, not the ones you say when you call. So D for the canine distemper, that affects all canines, even the ones in the wild. Hepatitis is just hepatitis that affects people and animals alike. Leptospira is a bacterial infection that also affects people and animals. So right now we talk, there's an outbreak of this disease called leptospirosis in people in Tanzania. So this is the reason you need to get your dogs vaccinated, and this protects the family and yourself. So the P at the end is parvovirus. So this is parvovirus. So this is the DHLP that your dogs should get annually together with anti-rabies. So hepatitis and leptospirosis can infect humans, and this is the time you want to ensure that your dogs are up to date with their vaccines. At the time you're hitting 12 weeks, again, you want to repeat the DHLP and anti-rabies, and by the time you're getting to 15 weeks, you get anti-rabies again. So this schedule varies from vet to vet and risk by risk, and also can be determined by breed. So if your risks are high, if you had a previous parvovirus outbreak, you will not stick to the schedule provided here. The interval is usually that you have about 2 to 4 weeks between the vaccinations. 2 to 4 weeks between vaccinations. So you will find your vet says, return the dog for vaccinations in 2 weeks' time. That is not wrong. This is dependent on their assessment. And if your intervals are between 2 to 4 weeks, it is okay. It is important to say that the reason as to why puppies are vaccinated from about 6 weeks is that when they are born, they come with immunity from the mothers. So when they have the immunity from the mothers and you vaccinate them, the immunity from the mother is likely to destroy the vaccine before it goes down. So by the time they're hitting 6 weeks, usually the immunity from the mother has gone down, and the destruction of the vaccine you're introducing, the chances will have also gone down. So that is the reason you start vaccinating at about 6 weeks. For Rottweilers, you will have to sometimes start vaccinations early because of the breed, they get affected. This is the same with other breeds like, I've forgotten that breed. So these are the schedules that you want to stick to when you're doing your vaccination. Then annually, you now do your DHLP. There have been schools of thought that when your queen or your bitch is pregnant, then you need to vaccinate them when they are pregnant. This is advised against strongly unless your vet says it is needed that they get vaccinated when they are pregnant, because at the end of the day, the immunity will go down. But sometimes these vaccines that you introduce, especially if they are live or live attenuated vaccines, weak vaccines, weak disease-causing agents, they can interfere with the development of the puppies or the kittens in utero. So this is where you want to consult your vet. Maybe you are getting a dog or a cat that you don't know their vaccination history, you don't know anything about them. At this time, then the vet will have to weigh between vaccinating or not vaccinating. Deworming your pets. You have puppies, you start, you deworm puppies. They're puppies up to the time they hit 6 months. Cats, kittens are also by the time they hit 6 months, and that's the point you want to consider them for another routine of vaccinations. But before they are 6 months, when they are starting, they're about 3 weeks, that's 3 to 4 weeks. That is the time to start deworming your kittens and puppies, because worms can really be a source of mortality to your puppies and kittens. So these worms will kill the kittens. So this is the time to vaccinate, and you do 2 to 4 week intervals to vaccinate your puppies and kittens. So when they are vaccinated properly, then you are sure that the puppies will be okay at the end of the day. Then we have, this takes care of everything. Then we have the case of toxoplasma from cats that can cause abortions in women. This is not every day, and not every cat has toxoplasma. But when you ensure that your cat is routinely dewormed, then you're reducing your chances of your cat having this parasite called toxoplasma that is a zoonotic. Zoonosis is an infection that can come from people, from animals to people and vice versa. So this toxoplasma is a cause to worry about, especially for if you're expectant. But if your cat has been through under regular deworming, then you can always be safe. Be sure that you're safe. Whenever you're expectant and you're not sure, your vet can screen your cats for toxoplasma. So just ensure that you take your cats and dogs for routine deworming. Worms that affect animals are also shared with humans. So if you have children and they're playing with the pets, they can actually pick worms from the pets, and vice versa. So your pets can also pick worms from the children. Whoever is not dewormed will get that. The picture below here of the heart, those are heartworms. Whenever you're traveling to the coast, the coastal areas of any country, you need to ensure that your cats have a preventive medication for heartworms, because these are transmitted by mosquitoes, and then they find their ways to the heart, where they multiply and cause a lot of havoc. So talk to your vet about preventive medication next time you're going on holiday in the coast, because these worms can get your dogs down there or your cat. For adult dogs, you deworm them every 3 months. And in case of any issues, you want to talk to your vet about this. So I think that's the basic issues I wanted to bring to your attention. So I'll stop my screen share and get back to Naomi.
All right, thank you so much, Dr. I think that was a very good and comprehensive overview of what we really need to do in terms of basic care. So I was looking at, as I was listening to your presentation, the first question I have is that bit about shampooing your pet and rinsing completely. So you mean we should not fully rinse them off, or is it that we should let the shampoo sit on the body for a bit and then rinse them off? Because I mean, the challenge is that you're letting, especially a dog, wander around the premises when it's still not dried off. Or should we just wipe them down and leave the shampoo on? Or what do we do?
So do I take a number of questions and respond, or do I take one by one?
Okay, we can take as many as possible. I guess we can do 3.
You can do about 3.
Yeah. Anybody with a question, please let me know. You can either put your hand up or you can put it on the chat and I'll unmute you. So the second one that I had in the meantime, as everybody thinks through their questions, are there any additional vaccines for cats and dogs other than the standard ones that you've given a list of that maybe we should be aware of and consider giving to our pets? We can start with those 2 and then continue.
So for shampoos, when you wash your dog with the shampoo and then rinse it off, it means you used it for the soapy effect, the soapy feeling, and then rinsed off everything. So there are two options. So make the correct dilution of the shampoo that you're using and then apply on the dog, mostly because they are used for dogs. The dog will shake off the excess in less than 5 minutes, and thereafter they will be okay. The other option is what you've asked. You can give them time to stay with the shampoo to have effect on the current parasites, but once you wash it off, then there will be no residual effect. So what we are looking for is the residual effect. So if you wash your dog with your shampoo today, you're going to leave the shampoo. If you wash it off, you will have dealt with the parasites that were on the pet at that given time. But if you wash it off, there is no protection moving forward. If you leave a little bit of it at the right concentration, then you should be having your pet having the residual effect of that shampoo over the recommended period. Additional vaccines, the only vaccine I know that is given in other places is for kennel cough, among others. So what we are doing in Kenya is quite okay because there are no other major challenges with the pets unless someone has other challenges. The other vaccines that exist are for other species of animals. So for dogs and cats, what we have is sufficient. We are having sometimes when the weather looks like there's quite a bit of kennel cough, but not at very pronounced levels. So it's something we can talk about at other levels. I think I see senior colleagues who may want to chip in if they have anything to say.
Dr. Joyce, let me just unmute you so you can make that observation directly, if you don't mind. Oh, she has no voice. Huh? So sorry, Paul Sana, Dr. So she's saying there are breeds that are more prone to parvo, which are the smooth-haired breeds. Maybe you can expound on that, Dr. Olum.
So the smooth-haired breeds that Dr. is referring to are majorly the Rottweiler breed of dogs and the Doberman breed of dogs. So they are their predilection to parvo is very high and their chances of getting the disease is very high. So these are the breeds of dogs I was talking about, that when you talk to your vet, then most likely you'll be advised to start your vaccinations against parvo from about week 4 of their life. So just to be able to protect them early before they come down with the disease. So most likely for Dobermans and Rottweiler puppies.
Okay. There's another question. We tend to see that, as we call them, Kenyan Shepherds, Kienyeji dogs, Maasai dogs, they tend to be less prone to illness, if you can say that. So is it that they just survive by the grace of forces beyond us? Or is it that they actually have a better sort of immunity? And does it come also because they're not really being pampered that much, so they learn how to survive and their body gains these defense mechanisms?
Interesting, but these fellows have been here for a long time. And in diseases, you find that the body and the genetics somehow does some form of selection over a period of time. So selection can sometimes lead to resistance of forms, and this can be perhaps the reason what we are looking at. The other reason we could be looking at is that their parents or the bitches or the other adult dogs get to interact with these pathogens all through their lifetime. So what happens is that when puppies are born to these stray dogs, then they have innate immunity, that maternal immunity, out of the dam or the bitch having interacted with these pathogens a number of times from their environment. So when these puppies are born with this immunity, it means their chances of coming down with the infections are quite lessened. So this could be what we are talking about. Some form of resistance could be there. There's no literature that we can, or no scientific literature that we can point at and say, yes, there is that resistance. But again, when you interact with pathogens out there, then you develop immunity to them when you interact with the disease-causing pathogen, a level that you could cause disease. But all in all, they still come down with the diseases. And most of us have grown up with them or have seen them in our homes. And when they die from parvo, this is a time that people usually say that they were teething and they swallowed their teeth and now they are dying because of that. But in essence, it's most likely parvo or worm infections at that age. So yes, there could be some resistance, but at the same time, there could be that interaction with pathogens as they grow.
Okay,
Same to cats.
You've mentioned something very common. That teething question. Do they actually suffer from teething, or is it just the appearance of parvo that leads into these symptoms occurring? So is there anything like actually swallowing teeth that affects dogs?
So at the time of teething, you look at the age of teething and look at the age when the maternal immunity goes down.
Okay.
This is about the same time, 5-6 weeks. So teething in itself, even in babies, is a stress, is a form of stress. So when they get stressed out of the teething, because even babies, you find some form of diarrhea and things like this. So if you, with this stress, then the infection now flares up. If it's a worm load, then the worms will now take a toll on them. If it's the parvo, then it now takes a toll on them. So it's the time that is coinciding. But swallowing the teeth, they swallow bones when they grow up. So it's not much of the thing. It's a myth that we have grown up with. And I think Prof. Mbugua, who is in attendance, is the one who demystified mine.
Yeah, okay. Okay. I currently don't have any questions on the chat. Does anybody else have another question? And for the vets who are present, do you mind if you want to chip in, please let me know if you have any additional details you want to give us. No questions and comments? Okay, Doctor, it seems you have a very quick session today. I don't have any questions and comments so far.
Hi, Naomi. This is Sarah Jamal.
Hey, Sarah.
I was wondering if I could comment on one thing, especially with fosters, because we deal with really tiny kittens and we usually deworm them at 3 weeks old. If Dr. could elaborate on that as well, please.
So when to start deworming and how many times to repeat?
Especially for fosters who are strays, they've never had that. The mama didn't get dewormed before, things like that.
So thank you, Sarah, and thanks for the good job you do. It's really humbling. So for strays, they have a challenge. The challenge they have is nutrition-wise, immunity-wise, and all the challenges about. So by the time they're hitting 3-4 weeks, they are so tiny that even swallowing, the reflex is quite difficult. So you can actually choke them as you try deworming them. So for them, because now when you rescue them, then they are in a better quote unquote sterile environment or clean environment. If they are not able to take this, and this you can do in consultation with your vet from time to time, you can open this up to about 6 weeks. But then once you start the deworming, if they are able to swallow the tablets effectively, because it should be quarter tablet, that then you then do this every 3 to 4 weeks to ensure that they are okay. So they have a challenge with their immunity and nutrition. So that's they don't grow up to the right size, and they also don't have the proper immunity because the queen or the bitch do not get the vaccinations on time. So they maybe do not even have the immunity at the end of the day, apart from anything the mother might have interacted with out there. So you can open up, but mostly if you are stuck, just do this in consultation with your vet.
Okay, thank you. Anybody else with a question? Okay, I guess that's it for today. Dr. Olum, any more comments? Dr. Olum, any further comments before we close the session?
All right, sorry, I was talking muted. So it's been interesting because we are giving pet lovers and animal lovers the knowledge that they can use for the benefit of their pets at home to ensure that they are always healthy and they are able to do preventive medication that really protects these animals from duress and stress, because a vet visit in itself to a pet is stressful. So if we can do the preventive medication and stick to it, then we should be able to be safe. Among that, if you're doing preventive medication and you are doing humane population control that Dr. Tutu talked about, of TNR talked about last week, then you should be able to have a fairly healthy pet almost throughout the year. I want to echo something that Dr. Tutu talked about last time, the notion that vets are expensive, but they are people at the end of the day. Health in this country is not cheap. So it ends up with what you put in, the medications and all this. That's why health is fairly expensive. So just get your vet to talk to them in an appropriate way, get that vet-client relationship. Once you have that, then you should be able to go away with a lot of things. If you have your vet and yourself in agreement and you're meeting your part of the bargain while your vet meets their part of the bargain. If that is done, all your pets should be healthy and covered by a vet or two. Thank you.
There's a question that has just come in from Karine. If you give parvo at 4 weeks to Rottweilers and Borbals, etc., when should you repeat? So maybe if you can just repeat the vaccination schedule.
So this schedule again varies depending on the advice of your vet, but the standard is 2 to 4 weeks. So if your chances, if you are a breeder, like I know Karin is, if you are a breeder and you have had a chance or a case of parvo at your kennels, it means, I'm using you as an example, it means the chances of your pet, of your puppies getting parvo is very, very high. So this is the point you want to ensure that they are covered in real time, so in good time. So you want to start early, and then you want to do the intervals. This is the time you want to go at 2 weeks to just ensure that they are covered appropriately in good time. If your risks are not as high, then you want to do 3 to 4, between the 2 to 4 weeks. 4 is okay, 3 is okay. Standard, most Kenyan vets are doing 2-3 weeks across board. So from time to time, just refer with your vet, and you should be able to get proper lead that suits your environment and needs.
All right. All right, thank you very much. Again, I wouldn't have done it without the assistance of the various veterinarians who are coming on board. And now we've had two, Dr. Tutu and Dr. Olum, who've presented. I will be reaching out to a lot of the vets as we move along, and I can see many of them here online. So I do have a schedule and specific topics that I would like to assign to various vets. They are the ones we work with closely, and especially for those who rescue, they are a lifeline for us. And they are the repository of this knowledge. So the more we learn from them, the better. Next week, I am going to do a session about understanding the various veterinary practices available and the practitioners. So I'm hoping to have someone from KVB available and from Keskava to talk to us so that we can help people understand what kind of services exactly you should be looking at and from what kind of practitioner you should also look for the same from. Because we've had a lot of cases of unfortunate cases of especially outright quacks, people who pretend to be veterinarians and they're not even trained in any way. And then we've had unfortunate procedures that have gone wrong and have had to be referred elsewhere. So I hope that I'll have the two organizations representing to be able to talk us through that. Yeah, so we'll be doing this Monday evenings. I hope you'll spread the word. Unfortunately, this week I was a bit tied up and I got word out late. So I'll have the next details of the next meeting out sooner than a day before. Thank you, everyone. I don't take your time for granted. I appreciate all the support you're giving us. So do spread the word for the next session. And I hope to see you back here again. Thank you, everyone, and good night.
Thank you. Good night. Bye.
Bye.